Now for the next type of drugs which we'll be looking at as applied to the treatment of urinary incontinence, we'll look at what's using antidepressant drugs. So these antidepressant drugs, we read in literature that these drugs can be able to increase urethral tone, okay, and relax the detrusor muscles. So now I want to now read, like, okay, what's the link up, like what's the mechanism of action, how is this possible in the first place? Okay, so tricyclic antidepressant drugs, like we'll state other examples, but most commonly used is what? Amitriptyline. Usually increases the urethral tone, it relaxes the detrusor muscles because they have anticholinergic and noradrenergic effects. Okay, so this makes them very useful if you want to treat what? Urinary incontinence. That's a condition where urine is just leaking out, okay, your sphincter is not being able to shut down urine up. Okay, so mechanism of action is anticholinergic effect. So they block muscarinic receptors in the bladder. So this will now what? Reduce the detrusor muscle from what? Contracting and pushing urine out. It will relax it. So this thing will be the bladder will be able to accept more urine and all of that. Okay. So noradrenergic effect enhances norepinephrine levels, will stimulate alpha-adrenergic receptors in the urethral sphincter. This will now lead to increased urethral tone, improving what? Resistance to urine leakage. Okay, during physical stress. Okay, so usually also acts on the central nervous system, modulating reflex pathways that are involved in bladder control. So examples of these drugs include drugs like what? Amitriptyline, then Imipramine, okay, then the last one is nortriptyline. Okay, so you can see all of them, the three of them under the tricyclic antidepressant. They are the most commonly used. So clinical applications is they are used in treating stress urinary incontinence, used in treating urge incontinence and overactive bladder. That's a bladder that is contracting too much. Then also they are used in treating what? Urethral pain syndrome. Okay, so this established the fact that you could actually use this drug in improving conditions where the bladder is over functioning.